I don't know, Sha. Before I was pregnant, to show that yes, I'm pregnant, and then get a testimony and answer that one. You understand? I bought a pack of pregnancy test strip. I will call Marcella. I'm not feeling anything. I'm not. She say, have you done tests? I will say yes. It's a lie. I've not done any tests. So, in fact, I climbed the upstairs. I did a lot of things. I say, this thing will not show. That's like the 8, 9, 10. I'm not feeling nothing. I was feeling normal. She said, okay, Madam Felicia, go and test yourself. As I bought the pregnancy test strip, 15 naira. I did the test. I saw one tick, one faint, but I bought a whole pack. I keep doing tests every day till I came for scan. Even when they were jumping 3, I was just looking at them because I know, but my heart is heavy. But God proved himself. I am now treated like a gold. Doctors, nurses, whoever, receptionists, all the staff of JOJE, I say thank you. To God be all the glory. I've not even come to show my babies to the doctor, but I will come. My babies are wonderful. My babies are healthy. My babies are fine. And I am a mother now. The Bible said, Psalm 113, I will give you a home where you will be called a mother. God gave me a home, and I am called a mother. To God be all the glory. Thank you, Jesus. Thank you, Lord. And I thank sincerely from my heart. I appreciate all of you. My babies are 7 months now. Yes, 7 months. By next month, 3rd, they'll be 8 months. Thank you, Jesus. Thank you, Lord. Now go day. Now go day. Now go day. Hallelujah. Praise the Lord. Praise the Lord. Praise the Lord. Adoration. We give him praise. My name's Mrs. Felicia Ebi-Ede. In fact, I don't know where to start, but let me just start from the middle. Because if I want to start from the beginning, I will not finish this voice note today. I want to return all glory and honor to God for using Dr. John Abebe, for using the nurses, for using all of them, the bio what, in fact, all of them, for making me a mother. I know it's God, and I really give him praise. Nobody can take his glory. My miracle is a story that, in fact, I have to tell people, I have to tell neighbors, I have to tell friends, I have to tell family. They know, those that are very close to me, they know my story. My story is different. My story is special. God used everybody, including even the taxi, because the day
ọba lábẹ́ àṣàṣì abiyamọ kíka tí wéré elédùmarè ọba tó ga jùlọ foundation tó solé ayé ró foundation nígbàlà mi mo dàgbé kọrùn fún bàbá tí ìṣèkẹ́ mi kábíyọ̀sì.
Ọlọ́wọ́ gbọ̀ngbọ̀rọ̀ is turning things around. Ọlọ́wọ́ gbọ̀ngbọ̀rọ̀ is turning things around. Ọlọ́wọ́ gbọ̀ngbọ̀rọ̀ is turning things around for my good. For my good.
Break every chain. Somebody raise up your voices and you declare that the chains are broken. The chains are broken. The chains are broken. The chains are broken. What do you see?
I don't look
What I mean.
Look at me now. I wasn't given a chance,
But God turned my life around.
I'm a proud of it.
do today is to look at some common medical problems in pregnancy that every human being has three different kinds of cells in the blood. You have what we call the red blood cells, the white blood cells, and what? And the platelets. Biology. Now, the red blood cell contains what we call the hemoglobin. It is that hemoglobin that carries oxygen. All right? And it is the red blood cells that help to circulate around the blood that carries oxygen from the lungs all the way to the different parts of the body, different tissues, and different cells where they are needed. Now, so when the hemoglobin is low, not the red blood cell, when the hemoglobin is low, that means the oxygen carrying capacity is low, then you say that this patient is anemic. All right? Now, the deficiency, the reduction in that oxygen capacity can be different severity. And that is why they will say there are different kinds of anemia. You have mild anemia, moderate, severe. Now, so if that hemoglobin is low, now that hemoglobin can also be low because of the red blood cell that was destroyed itself. So yes, the cells can also lead to a reduction in the hemoglobin because the hemoglobin is contained in the cells. All right? Now, the interesting thing you need to know about the formation of the red blood cells is that these are usually formed by the bone marrow, okay? And the ingredients that are needed for this to happen will include iron, folic acid. Those are the principal elements that are needed, okay, for the formation of red blood cells, and then the hemoglobin that carries the oxygen. And that is why when a woman is pregnant, she takes supplements so that the body does not lack iron and folic acid. So, one very important question you want to ask is, what's causing this deficiency, this anemia? Why would a woman become anemic? With all the food that she's eating, spending the husband money. You now say, you go to hospital and doctor will say, you don't have blood. Why? So it's very important for us to know what causes Anemia. Next slide. So most women will not have anemia in pregnancy. All right? Most women who are healthy, who are eating right, who are not losing blood, who were not anemic before they became pregnant, they will not be anemic. Now, in terms of figures, we say that a woman is anemic when her packed cell volume is less than 30 or the hemoglobin is less than 10. All right? In the more advanced world, they use 33 and 11. For us here, we know our women, so we use something lower because environment differs. Now, when a woman is pregnant, we expect her packed cell volume, that is the blood cells, and then the hemoglobin to be at that level and above. Women who are not pregnant, they usually have PCV of above 35, 37, all right? Now, there are some women that before they get pregnant, their PCV is lower than normal. Who are this category of women? Women who are not eating well, women who have very heavy menstruation. So even before they got pregnant, they were already deficient in the packed cells, in the hemoglobin. There was already iron deficiency. The body did not even have enough iron because the way the body works is that once there is a reduction in the hemoglobin, it will trigger the bone marrow to want to produce more. And if the bone marrow does not get enough raw materials in form of iron and folic acid to produce the hemoglobin, the red blood cell, it will not produce it. And so you have a lot of deficiency. We call it iron deficiency anemia. Principally because the raw materials needed to produce the red blood cells are not present. Okay? And of course, the women who constantly who are sick, they're having malaria. I know when you have malaria consistently like this, the malaria, your red blood cells will be broken down. All right? And once they are destroyed, it loses the hemoglobin and the oxygen carrying capacity will be reduced. Okay? So we say that either you're not having enough, meaning that you're not eating well, you're not eating right. You know there are a lot of people, they just eat junk food that does not contain nutrients, and they think they are eating. By the time you check their blood, nothing. All right? It's either you are not getting enough to produce, or you are losing what you have. And most times, the loss either comes from blood loss, or it comes from sickness. Now, when a woman is pregnant, there is also what we call physiological anemia. What we call physiological anemia. And what that means is that the pregnancy created a situation where it appears as if your blood level went low. And how does that happen? Because there's an increased blood volume. Because your body is getting ready for delivery. When a woman is going to deliver, she must lose some blood. That one is known. Whether it is vagina or cesarean, blood must come out. So what the body does is to prepare for that day by ensuring that your total volume is increased. So your total volume is increased, but the red blood cell itself does not increase. So what happens? There will be what we call hemodilution. And so it will appear as if your blood level, the PCV, drops. Okay? And when a woman is pregnant, the demand for folic acid for production of red blood cells is more. Remember, the baby you are carrying is a parasite. It depends on you. Everything that the baby will need to feed, to grow, to produce all of those tissues, organs are coming from you. And that is why suddenly you will realize that the demand for iron and folic acid increases. And that is the reason why we say we give women who are pregnant supplements. Because we believe that the one you are taking in food will not be enough to take care of those extra demand. Alright? And so that on its own can lead to what? Anemia, but it's not much. I said most women who are healthy, who get into pregnancy healthy, they will do well. They won't have issues with anemia. But when you become pregnant and you are no longer eating well, you are bleeding, you have malaria, all right, anything that either causes you to lose blood or to have your blood destroyed will cause you to have anemia, or will make you not to have enough raw material to produce the red blood cell, will make you to have anemia. Okay, so next slide. So what are the symptoms of anemia? How do you know a woman has anemia? I just look at you now. It's like well, how do you know a woman has an anemia? So there are symptoms. Okay? So most women who are naturally healthy, when you check their PCV, everything will be fine. But there are common symptoms of anemia. When a woman starts feeling tired, oh, I'm always tired, no strength. You walk from here to that place, you are panting. You climb stairs, you have to stop halfway and rest before you continue again. Most likely means that your blood level is low. You are feeling dizzy. You just stand up and then your eye will just turn you and then you want to fall. You're always breathing fast. Even when you are resting, even when you have not walked, you are sitting down and then you see yourself just that you want to take in enough air. Most likely you are having anemia. Or when your heart is beating very fast. Okay, you are breathing fast. Your heart is beating fast. You are feeling dizzy. You are feeling tired. Most likely your blood level may be low. Alright? So those are the symptoms of anemia. Alright? And these symptoms will all manifest based on the severity of the anemia. So people who have mild anemia, whose blood level is just less than, a bit less than 30, maybe 27, 28, 29, alright, 30 PCV, they may not have all of these symptoms, although they are anemia, although they are anemic. Why? Because it is mild anemia. Most women that will have these symptoms I've talked about are women who have what we call severe anemia. That means their PCV is already less than 7 grams per year. Or, their hemoglobin and PCV less than 20, less than 22. Those patients, once your PCV is less than 25, you begin to gradually develop those symptoms. All right? So what are the other ways how does the doctor diagnose anemia in pregnancy? So usually when you have all of this complaint and you see your doctor, the doctor will ask you to go and do a PCV. Routinely, for all women who are pregnant, it is part of the routine test, antenatal test that you do. And why do we do that test? We want to be sure of your starting fat cell volume. Like I said before, there are women who enter pregnancy in a deficit, already anemic. So when they now get pregnant, the pregnancy now makes it worse. So if you don't pick up that the fact that this woman is already anemic, she will be struggling throughout pregnancy. The baby will not do well. The baby will not grow well. So we do a fat cell volume when you come to register for your antenatal. So we already know, okay, this woman is not anemic. And then you continue. We give you your medication, your supplements, you continue to take them. When you get to 28 weeks of pregnancy, we will repeat that procedure again, just to be sure. Now, this woman has done 6 months. Did her PCV drop? Did it remain the same? Or did it increase? So we will know. Then based on what we get, if we see that, this PCV is even increased. This woman, you are chopping life. I say, good, continue. If it dropped, we'll start the question, why did the PCV drop? PCV we did when you started pregnancy was 33, 35. Now we are getting 28. Did you fall sick? Did you have malaria? Or were you bleeding? Now say, in my first trimester, you know, it was God, though, this pregnancy. We don't say, okay, maybe because of the bleeding that she had. I had malaria several times. Okay, maybe it was malaria. The red blood cell was broken down. So we check it at 28 weeks. Then when you get to 36 weeks, we check it in. Now, 36 weeks is now preparation for delivery. Because just as it is not good for a woman to enter pregnancy with anemia, it's not also good for a woman to go to delivery with anemia. Because like, what did I say? I said every woman that is going to deliver must lose blood. Whether it is small or big, you must lose blood. Whether you are doing CS or you are doing vaginal birth, blood must come out. It's part of the process. Your body gets you ready for it. But what we don't want to happen is for you to go into delivery with your blood level low. Because if you go into delivery and your PCV is low, even small blood loss, wahala. Because why? There is no reserve. So that is why we will check your PCV at 36 weeks. You know, delivery will come from 37 weeks. Even if you are doing an elective CS, here we deliver at 38 weeks. If it's vaginal birth that you are having, once you get to 37 completed weeks to 42 weeks, that's the period where most likely your vaginal birth will take place. So we make sure that we are able to make the diagnosis early enough, and then if it is low, we can now correct it. Okay? So next slide, what can be done to avoid anemia? So we'll talk about the symptoms. So can anemia be avoided? Yes, it can be avoided. So how do you avoid it? Number one, by making sure you eat well. Get a variety of food. You know, there are people that don't like eating fruits. They go for the hard one. Swallow. Give them fruits. No. I don't do fruits. Give them vegetables. Say, it turns my stomach. Turns your stomach. Meanwhile, those are the things that contain iron, folic acid. So you need to eat right. So if paraventure you're not eating all of these things that we are talking about, then you must take supplements. So some women will say, I forgot to take my supplement. So 1 week has passed. They forgot. No, that's not good enough. Because everything you do, you're not doing for yourself, you are doing it for your baby. I didn't mention when I was talking about the causes of anemia. Women, when a woman gets pregnant, that pregnancy alone will drop the PCV and the hemoglobin. So when the woman is not carrying, the number the woman is carrying also matters. The one that is carrying 1, you are feeding for 1. If you are carrying 2, you are feeding for how many? 2. If you are carrying 3, you are feeding for how many? The consumption is simple. No. So that is why it's very important that you are mindful of this. And so a woman will take all of these things, vegetables, spinach, liver, dried fruit, cereals, wholemeal bread, beef. All of these things, they all contain iron. And more importantly, a supplemental iron, okay, and folic acid. And that is the reason why we say that women who are going to get pregnant, just because we want to avoid women getting into pregnancy anemic, we ask them to take folic acid for 3 months. Folic acid, iron, all right, for 3 months, just to be sure that all is well, all right. And so to prevent the anemia, you make sure you eat well, and then you make sure you take your iron supplements, folic acid, regularly. And if you're sick, make sure you visit the hospital. You treat malaria early. If you are bleeding excessively, go to the hospital. All right? All of this will help us in preventing anemia. So how do you treat anemia? The treatment of anemia depends on the severity. Okay? Depends on the severity. If most women will have what we call mild to moderate anemia. All right? For those ones, most times we use iron supplements. Okay? With iron supplements, you are able to quickly, the bone marrow is able to quickly build up the red blood cells, and then we are able to correct the anemia. If it's very severe and we are not able to rapidly build up your red blood cells, either because you are constantly losing blood, or you are very close to delivery, or the anemia is so severe that it's already affecting you and the pregnancy, and we need to quickly restore the red blood cells, then we'll offer you blood transfusion. Once you get blood transfusion, it will replace the red blood cells, and you will just drastically have a relief from all the symptoms that you are having. And then, of course, when we are managing anemia, we want to look for the cause of the anemia. What is causing this anemia? So we don't only treat or correct the anemia, we also treat the cause of the anemia. So what are the possible complications of anemia? All right. So the possible complications of anemia would include the fact that you are having difficulty breathing, you have palpitations, you are conscious of your heartbeat, you have chest pain, angina. You could also go into shock, particularly if you lose blood after delivery. And once you go into shock like that, blood is not going through your vital organs. Those organs can shut down. It can lead to intrauterine growth restriction. Baby is not doing well, particularly if it's a chronic anemia. If you are anemic almost all through the pregnancy, baby was just managing. Imagine a child that is on 001. The child will not grow well now, compared to a child that is on 111. Morning, afternoon, night, even half midway, he still eats. That child will become over. But a child that can only afford only one a day, that child is just surviving. All right, and so that is what happens. So these are also some of the complications of, and because your body is not getting enough oxygen, all of the systems will just be working on reserve. They are not working optimally. So very shortly, your heart begins to complain. You understand? Your kidneys begin to complain. Your liver begins to complain. Even your brain too begins to complain. Every part of the organs begin to complain. That's why it's not good for someone to go on to become anemic chronically for a long time. All right? The body will try to respond to correct it, but sometimes we need to assist the body to correct the anemia. All right? And of course, once you make all of those corrections, the body bounces back, and then you are good. Okay? So that is anemia in pregnancy. So the next common condition we will talk about for today is malaria in pregnancy. All right? Malaria. How many of us have had malaria in pregnancy before? Sorry. 2 times, 4 times. How many times? 2. You. None. Lucky you. You. None. Lucky you. You. 3 times. Sorry. All right. So, malaria in pregnancy is common. Why a lot of women will not have malaria? Quite a number of them will have malaria. You know, malaria is part of our it's common. That's why I say malaria is endemic. It's part of us. How many of you have seen mosquito before? If you say you have not seen mosquito, I'll say, no, you're not living in this part of the world. Maybe you just traveled from Atlanta. And you just landed and you came there. All right? So, mosquito is something that is very common. And even now, right now, during rainy season, this is the season where they multiply a lot. And that is why during the rainy season, we should make sure that there are no stagnant water. We clear all our surroundings and make sure that everywhere is clear, is free. Okay? Because the Anopheles mosquito is what carries the Plasmodium falciparum. And it is that particular one. There are 4 species: Plasmodium falciparum, ovale, verus, and malaria. It is the falciparum that causes our malaria. And why, for a lot of people, you have malaria, it doesn't benefit. The body will just tackle it. You know, you have soldiers in your body that have AK-47. Any unwanted visitor, we just deal with it. All right? Unfortunately, when a woman is pregnant, those soldiers, they go on sabbatical. Many of them are on leave. And many of them don't have their AK-47. And so when you now have an invasion of these strangers, they are not able to fight as much. Why? Because the immunity is low. Yes, so the pregnant woman's immunity is diminished, is reduced. And that is why you will notice that why you do not have malaria while you are not pregnant. Suddenly you are pregnant and now you are not having malaria. All right? And women who get pregnant for the first time, their malaria tends to be more and tend to be more severe. Why? Because that is the first time they are getting pregnant. That is the first time the body is going through that kind of situation. So it's not used to it. So the soldiers are not adjusted. When a woman goes through first pregnancy, by the time she's getting pregnant the second time, soldiers are adjusted. They now know that, okay, this is the terrain. And so a lot of the challenges that women have, they won't have it in their second or third pregnancy. Okay? And that is why you notice that malaria is one of the things that kills a lot. It's a killer. In this part of the world. It kills, and it kills those most vulnerable, whose immunity are not very strong. That's why children are most affected. All right? Infants, children less than 5. The mortality is a lot. And they're pregnant women. And that's why we tell you that when you're pregnant, apart from the fact that you're eating well, you have symptoms of malaria, treat it. And they will now also give you malaria prophylaxis. So that we don't want you to be having malaria frequently. But even if you have malaria, let the malaria not be severe. All right? Because the malaria can become very severe, and that can really impact on the pregnancy. So what are the effects of malaria on pregnancy? So you have it there. Malaria can have serious adverse effects on pregnancy that will include abortion or miscarriage. You can lose the pregnancy. So someone can lose the pregnancy because of malaria. All right? You just miscarriage, particularly in the first trimester, second trimester. You have fever, start having contractions. All right? The malaria parasite can go and attack the placenta, preventing normal blood flow to the baby. Okay? And so that will cause intrauterine growth restriction. And then low birth weight. If it's not growing well, what will happen? The baby will not have weight now. So you have low birth weight. Like I said before, the malaria can cause your red blood cells to be broken, to be destroyed, leading to what? Anemia. Okay? And many people are admitted in the hospital because of malaria. And then you are losing your time at work, and then you are losing money because you are not in your business. So it can have a lot of effects. So what is the way out? How do we tackle this issue of malaria? So it's because of the high mortality, high morbidity of malaria. That is why the World Health Organization have advocated, and we have been practicing it for a long time, malaria prophylaxis. What does that mean? It means an attempt to prophylactically prevent a woman from getting malaria, or reducing the severity or the number of the frequency of malaria attack during pregnancy. So what do? We give you medication. No, you only take medication when you are sick. So we now give you prevention, malaria prevention. So that when you take that, it is not treating malaria, it is preventing you from having the malaria. Okay? Prevent you from having malaria. So that's why during the course of the pregnancy. Now, what are the medications we use for prophylaxis? We use the intermittent preventive treatment, use of the perimethamine, that's Fansida. And then we also give the Proguanil, either of them. The Fansida is given first dose after 16 weeks, second dose after 4 to 6 weeks, third dose after 4 to 6 weeks. But you don't give anything less than 36 weeks, you don't give any more, because it can cause jaundice. While for the Proguanil, it's a daily medication. Before those days, we used to give Sunday medicine therapy. So we have stopped that because evidence showed that it was not as effective. So what we're not doing now is the intermittent treatment with Fansida, or we use Paludrin. For most of our patients, we do Paludrin. The reason is because that sulfur, that Fansida can, for patients who react to it, can be bad, can be terrible. Except you have taken Fansida before, or you have taken Septrin, or any of those sulfur-containing medication, and you didn't react. If you have never taken them before, you have never used Fansida before, and now you are not pregnant, I would rather give you Paludrin. You take it every day. I know you prefer Fansida, you take it once. After 2 months, you take another one, like after her. But so scared. When you see a patient who has what we call Stevens-Johnson syndrome, not a joke. It can be life-threatening. So that is the reason why most people will notice that here at the Center for Women's Health of the Jubilee Hospital, we give more of Paludrin to prevent pregnancy. And if you have symptoms of malaria, we'll treat you. All right? Our treatments are safe in pregnancy. All right? And then we do that, and then most times you recover. And we ask you to make sure that you also make sure that you use mosquito nets. Make sure that your home is not infested with malaria. If it does, you can use insecticides to make sure that you take care of the mosquitoes. And then you just ensure you prevent yourself from being bitten. Of course, if you do have malaria, then we will treat. A lot of times, those treatments can be done outpatient basis or inpatient. If you're having severe malaria, most times when you go for tests, they tell you have 1+. Is it 1+ that's causing me all these things? When you are pregnant, 1+ can become something. But when you start having 2+ and 3+, that means the parasite entered your body and it started making, So for that, you need to be treated. So we give oral medications. Now, the most common one that we use is the artemisinin-based medications. Coartem, all those Anatenatal-based. So we do injection and then plus oral. Okay? And once you do that, you are good. Okay? And if you have other complications of malaria, anemia, all of those things, you may need to be admitted. Based on what the complications are, you would be treated. All right? Okay, so we are done. So we'll take 2 for today, and then next time we'll take the remaining 2. All right? Those that didn't come on time, they know themselves, so they should come early next time. Let them go and watch the video. Okay? All right. So, any question on what has been taught or any other question you have in mind? Now, you are free to ask me any question. Yes, please. Sit down. Is low. What does it mean? So when they say the placenta is low, it means that, the womb, it has different parts. You have the fundus, which is the up, and you have the body of the womb, and then you have the lower part, and then the cervix. When they say the placenta is low, that means it is towards the cervix. Okay? The placenta should not be towards the cervix. If not, it will block where the baby will pass through. The placenta should be up in the body, in the fundus. Okay? And once they say it is low, it means that it has come to the lower part of the womb. And there are different types of placenta, or placenta previa, which helps to define how low it is. There's one they call type 4. That one is sitting on the cervix like this. Say, I'm here. Maybe you cannot pass through me. For that kind of patient, you can't, vaginal delivery is totally, but for all the types of placenta, now the best way to deliver them is through cesarean section. So baby cannot come out. The placenta is going to come out first. And if placenta comes out first, that baby will come out dead. Because the placenta is what supplies the baby. If the placenta is not detached from the womb and now comes out, that means that baby would not be losing blood. So if they say the placenta is low, it means that the placenta implanted and is on the lower part of the uterus. But the good news is that most women will not have that kind of bad one that will go and sit really down. They just be low. And sometimes if they tell you early in the pregnancy that the placenta is low, don't worry. As long as you're not bleeding, you just keep doing your scans. For some patients, towards the end of that pregnancy, as the lower segment begins to form properly, that lower part begins to form, it will appear as if the placenta moved up. It will no longer be low. So when they say the placenta is low, I want to ask, what is the age of the pregnancy? If a woman is still in her second trimester, I'll say, no, don't worry, relax. Are you bleeding? No. Okay. Yeah, so if it's at 20, if at 20, it depends on how low it is. There is still chance that the thing can still go up once the lower segment is being formed. All right? But for most women who have low placenta, well, for my patients who are here, most of you are going to deliver through cesarean section anyways. So there's really no problem. It's just that for women who have low placenta, we get ready on the day of delivery because we tend to lose more blood. Also depends on where the placenta is located, whether it's anterior or posterior. For some women, we may need to cut through that placenta to get to the baby. So we need to be fast in our delivery, and during that process, they lose more blood than women who don't have low placenta. If you have low placenta previa, you generally will lose more blood than women that don't have low placenta. Because that part that the placenta stays, it doesn't contract and stop blood as fast as the upper part. But that is not the problem. We will deal with it. Okay? Question? No question is funny. No, it's not possible. If you don't have placenta, that means the baby did not feed. I mean, how would the baby feed? Yes. It is the placenta that attaches to your body. It is that placenta that is from there that is what receives all the nutrients, everything that you have to offer that baby. It gets it through the placenta and then goes towards the baby. Anemia. It depends on what food. It depends on what food. Yes. How you want to do it. Yes. No, it's okay. That's a very, very good question. Okay. So let me say that most of our patients, particularly those who got pregnant through assisted conception, we give birth through cesarean section. And I'll tell you the reason why. Most of them, they have medical history that will teach them in that direction. Most of them have never delivered before, and they are advanced in age. Most of them will have many years of infertility. The woman has waited for 10 years, 15 years, and you say, come and push. Push waiting. So come and try. Something happens. What can you tell the woman? That I was trying to push waiting. Yeah, that's it. So, and most of them will probably have had surgeries, myomectomies. So you don't want to take that woman through vaginal birth, because you take that kind of woman through vaginal birth and the uterus ruptures. What will you tell the woman? So most women who go through fertility treatments, they are high risk. They are women who you want to reduce the chance of any complications occurring. The women who you want to take the safest path. It's not as if vaginal birth is not safe, but it's just that there are things that can happen that you don't want to just take that risk at all. That is why we offer them cesarean section. So it's possible, very, very possible. That's what we call VBAC. Vaginal birth after a previous cesarean section. After one previous cesarean section. So if for any reason a woman has a cesarean section, and that is the only surgery you've had, in the second pregnancy, maybe you got pregnant naturally, understand? And there are no contraindications to a vaginal birth. You can give birth vaginally. But if there are contraindications, there are certain things, each pregnancy, you have to look at it in its merit. All right? Why did this woman have tears in the first pregnancy? Is this still occurring? But let me say that a woman who have had a CS before is more likely to have another CS than a woman who have never had a CS before. All right? So ask, it's okay. You are asking all their questions. Please go ahead. Sacrilege. During the delivery. For women who are, because most women here deliver through CS, we don't bother removing it before the day of delivery. So it's on the day of delivery, after we have delivered them, that is the last thing we do before we clean them up and then take them to the recovery. No. Affect baby, does that? No. If, speaking generally now, and not just what we practice here, if a woman has a cervical sacrilege, because of an incompetent cervix, if she's going to have a vaginal birth, that sacrilege should be removed at 36 weeks. Yes. Before contractions will start, if she's going to have a vaginal delivery. But if she's going to have an elective cesarean section, there's no need removing it. Because to take her that thing can be painful. Why would you want to cause pain? So just leave it. When she delivers, on that same period, before she's taken out of the theater, you just take it out. That way, she won't feel pain. So she has already been taken care of. She's under anesthesia. Final. She's not feeling any pain, so you just take it out for her. We don't like causing pain for women. I don't like causing it at all. That's the reason why. Okay. Okay. That's a very, very good question. All right. So, once a woman, you have had your embryo transferred, it's expected that 2 weeks after you tested positive. Implantation starts occurring a few days after the transfer, because you are transferring a blastocyst, which means that few hours after the embryo lands in the womb, a blast will release that embryo, and then implantation occurs. And so the baby implantation continues for most of the first trimester. All right, particularly the first half of the first trimester. Right, it continues to take place. Then, by the time you are doing by 8 weeks, when you are doing your first scan, a lot of that implantation has already taken place. All right, so any bleeding you are having after that 8 weeks is no longer implantation bleed. It's more like a threatening miscarriage that you are having. That implantation bleed is when the implantation is taking place. That first 1 week, 2 weeks, which is mostly before you even do your pregnancy test. That is when that implantation, the implantation takes place. Every other thing that is happening is no longer implantation, because the baby now growing, developing placenta, and all of those things. All right? No. It's not everybody. Not everybody. Yes. So we normally schedule our patients who are for elective cesarean section here at 38 weeks. Some of them are 37 weeks, depending on how many you're carrying. And usually, most women will not have contractions at that time. So before contractions will begin to come, you would have been delivered. No, you don't need to wait for pain. You don't need to wait for contraction. Once you, in fact, for those who are giving birth by cesarean section, you pick your date. You tell me, this is the day I want to deliver. I want to deliver my baby on my birthday, on my husband's birthday, on my mother's birthday. If it falls, say for example, you have 37 weeks, 38 weeks, 36 weeks, and you say, doctor, I think I want to deliver my baby on my birthday. I know people that do that kind of thing, and they are serious with their goal. You want to share with your child's birthday so that you don't spend money, so that you celebrate the birthday once. I know. So once you want, so if you get to the period where you are 36 weeks, for example, you are 37 weeks, and your birthday falls at 37 plus 1, instead of delivering at 38, we'll deliver at 37.1. You understand? It's already time for you to deliver anyways. Understand? And so that's why. So you have that liberty of choosing the day you want to deliver. I give that if there are no contraindications, your doctor will tell you. If you are opting for a vaginal birth, then they will have to check to be sure that everything is okay for you to give birth vaginally. Check the position of the baby, they check the weight of the baby, check your medical history to be sure that you don't have any conditions yet or complications that will contraindicate the vaginal birth. That swollen leg is not. Now, question. See, that is why you are unique. They say the pregnant woman is a fourth human being. You are different. You are carrying pregnancy. You are carrying baby. And you are asking why are some people's legs so? Everybody is different. Some people are carrying one, some are carrying two, some are carrying three. Are you carrying? It's one. Wait, I'm still coming. All right, see. Well, your leg swelling is not a problem in pregnancy. Oh yes. Except, of course, if there are other challenges, like your blood pressure is high, or you have protein in your urine. Now, if you have that, then we are not asking, I hope this one is not preeclampsia. It's not pregnancy-induced hypertension. So we want to be sure that that is not it. If that is it, then we'll now begin to manage you, to make sure that we control the blood pressure, to make sure that we rule out other factors. Okay? But if all those things are all normal, your leg swelling is not a problem. In fact, we say a woman whose leg is swelling, it means the placenta is working better. And if someone, if I say now, through the leg cannot swell, now say, doctor, are you now saying my placenta is not working well? Okay, I stop. But just know that your placenta, your leg swelling is most times not a challenge. It's normal in pregnancy. Because of the hormones, particularly progesterone, or the other hormones produced by the placenta, your tissues, they become very permeable to fluid. The fluid will now leave the vessel and start going into all those tissues. So you now start having leg swelling. But some people, their own will be on their wrist. So they now begin to have what we call carpal tunnel syndrome. Their hands, they can't hold something very well. They'll be weak. So the fluid will be different. Some will even have fluid on their tummy. Their tummy will now begin to produce those things that look like back of orange. Some people can be so bad it will even extend from the leg all the way down here. Like I said, as long as your blood pressure is fine and there are no other issues. Okay. Now for the cramps, that one is also, you see, when you are now advancing, getting a position to sleep now becomes an issue. Because you cannot sleep face up like this, except there's something to raise your head up at angle 45. So you have to sleep either on your left or your right. And if you sleep on your left for a long time, you get tired. This place will do as if it has paralyzed. So you have to turn towards the other side. So you turn towards the other side, right? And then you will now, so like that. So, and it usually worse by the time you are getting close in the third trimester. It becomes it's worse then, yes. But you just manage and manage. The baby is preparing you after delivery. So when babies are at night, they are awake, they are alert. So since you are used to sleeping in the night, baby is telling you, train now, because your night will become day and day become night. That is how it is. You will just feel, you will feel pain, but it's not worth taking that anesthesia for. Not worth it. No. The BP maintenance are safe. Yes. Medication. So it depends. If it was a pregnancy induced, then after 6 weeks, when all the effects of pregnancy have gone, then you can stop because it was pregnancy induced. But if it is a chronic hypertensive, for those who had it before they got pregnant, or those who even discovered they had it while they were pregnant, once the blood pressure does not return back to normal after delivery, then that means it's a chronic hypertension, then you may need to take it continuously. All right? Any question from our online audience? Okay. Okay, there's one thing. God bless you, doctor. How can BP be managed in pregnancy for... Can you take that one up? So Dan, can you bring it up so I can... Okay, so please, how can blood pressure be managed in pregnancy for someone who has BP issues already before pregnancy? Okay, so for someone who has blood pressure before pregnancy, that means you were already on antihypertensives. Okay, and we usually say that please make sure your blood pressure is controlled before you even get pregnant. So for our patients who are coming for IVF who want to get pregnant, that's part of what we do before they get pregnant. And so they're taking their blood pressure medication. So we will check to ensure that those blood pressure medications, they are safe in pregnancy. If they are not safe, by the time they are doing their embryo transfer, we would have changed the antihypertensive to safer ones, and then they continue with it. Once they get pregnant, we continue to review their blood pressure and ensure that the blood pressure is controlled. If it doesn't get controlled, we can either increase the dose of medication or add more antihypertensive to the medication we are taking, just to ensure that we achieve control. So that is how we take care of the blood pressure. They permit me to ask this question. I was implanted 3 embryos. When they said 3 employees. To God be the glory. The ultrasound showed that 1 succeeded. My worry is I didn't bleed. Where did the rest? They didn't go anything. They disappear. You don't need to worry. You don't need to worry at all. Embryos are very tiny. You can't see them with your naked eye. So they just melt away. They just disappear. They don't implant. They just dissolve. Yes. So the one that implants will not continue to grow. So no, if it implants, if it goes out, that means you're not talking about having a miscarriage. So yes, we understood. Dr. Keep the Guru, I love you so much. I love you too. You're a blessing. No. Okay. I think your body absorbed it, yes, correct. So thank you, very educative. Okay. Any other question? Okay, that's all. Okay, all right. So I want to believe I've answered all the questions. So I want to thank every one of you, both our on-ground clients and online clients who joined in for this month's antenatal class. I want to believe that it has been very educative, and I believe that we have learned one or two things. I want to, on behalf of the team, wish every one of you a very successful, uneventful, peaceful, uncomplicated antenatal period, and to wish you a very, very safe delivery. For those of you who will be delivering here, you are very assured of our best care. For those of you who will be delivering outside the country, I have just one request. I would love to be at your delivery. Buy me, all expenses paid by you. I fly business class and I do 5-star hotel just for 3 nights, just to witness your delivery, and then 3 nights only, and then I'll be back. And please, for all of you who will not be delivering here, please send me my baby pictures. All right? Send us the pictures so that we can celebrate, we can rejoice with you. But I know that it will be a great time, a great occasion where God will transform and turn around the fortune. And what you most desired, what you wished for, what you dreamt for would have come to pass. Once again, congratulations and have a great weekend. God bless you.